yourself fully on the mats. Then lift your hands all the way up this way. Let's do a bit of the Chinese style of good health. Bring your hands down. Now what does it now is insignificant without your breath. Alright? So this time as you inhale, lift up your hands all the way up into the sky. Inhale. Lengthening. Your palms facing each other. And as you exhale, bring your hands all the way down. Inhale, lift your hands all the way up into the sky. Breathe in. Breathe in. Keep breathing. Keep breathing. Once you get there, hold the breath. Exhale, bring the hands all the way down. And let's advance this. Inhale, lift your hands all the way up into the sky. Hold the breath there for 1, for 2, for 3. And as exhale, fold forward. Simply just touch the ground as fast as you can go. Lift up again. Inhale, lift your hands all the way up into the sky. Inhale. Breathe. Hold the breath there. Lengthen more. And as you breathe out, gently fold forward. Lift up your hands. Inhale. Bring your palms together. Hold your breath. Gently exhale. Bring your palms all the way to your heart center. Breathe out is possible, my friend. Prayers to love yourself. Thank you very much.
Smoking. When I was younger, it was very rare. If there was somebody in my town who smoked, everybody in the town knew that one person who smoked because it was so unlikely. Now, it's everywhere. I don't go to clubs, but for those who go to clubs, you can see multiple people, young people smoking. The youngest person I treated for a heart attack at my hospital was a 30-year-old guy who doesn't smoke every day. Just used to smoke when he goes to parties or when he went to the club. He blocked the artery at the front of his heart. He nearly died. He had to open the artery for him. He was very lucky to survive. So for all the young people here who smoke or are exposed to secondhand smoke, you are increasing your risk of early cardiovascular disease. Obesity, very topical. Again, just tying up everything I've said before, we are gaining weight. Again, I'm sure if I had a picture to take of a broad section of the population 30 years ago to compare to now, what you will find is that a lot more people today are overweight because we are not exercising as much as we used to. In the old days, everybody was on the farm. Everybody walked long distances to get from A to B. So there was constant exercise, just like John Anene was saying. But these days, we don't exercise. Most people's jobs, you are sat down at your desk from 9 to 5. Then you sit in traffic from 5 to 10 before you get home. And so there is no opportunity to move up and down. The few buildings that have stairs, everybody now uses the escalator or the lift to get up and down. And then by the time you get home at 10, the opportunity to exercise, to start going to the gym or doing yoga is kind of gone, to be honest. Most people just don't have the time. And that's why obesity has become a huge problem in our population, and this also increases the risk of cardiovascular disease. So all of these things is all the bad news. So what can we do? Some of you will be thinking, I'm going to say, come and see me in the hospital. Not at all. Some of you will be thinking, okay, we have to go and get a gym membership and be working out 5 days a week. Not necessary. The things you need to do are much simpler than that. And really that is the essence of today's talk. So what we need to do is we need to assess your risk. All the things I mentioned before contribute to risk. So if you have any one of those risk factors, that's something to be aware of. If your 10-year risk, there are calculators for this. If your 10-year risk is more than 10%, you should be taking an aspirin every day. If you have high blood pressure, you need to treat it. There are very few things I want to say today that you need to remember. But this is the one thing I want you to remember. 130/80. One of the biggest problems we have, I mean, I won't even ask for a show of hands. Even this is a young population, but the number of people who are sitting here who have high blood pressure. Because I can bet anything that at least 3 people here already have high blood pressure. The thing to remember, the key number is 130/80. So if you have high blood pressure and you are taking tablets and your blood pressure is 150, you are not doing anything. You are wasting your time. It is no point saying you are treating it and then your blood pressure is not at 130/80 or less. If it's not, please today go and find your doctor and say, excuse me, sir, you are not doing your job properly. My blood pressure is not yet at 130/80. I'm still getting 140, or I'm getting 150, or I'm getting 160. Or even worse, if you haven't gone and checked your blood pressure for the last 2 years, please go and see your doctor and get your blood pressure checked.
I tell people, once you want to eat eba or any other food, eat vegetables and eba. Not eba and vegetables. There's a difference. Vegetable and eba. Eba and vegetable. The one that will be plenty is vegetable. Vegetable and eba. Oh, if it's eba and vegetable, of course. Eba and vegetable. That's the first part. More vegetable and big eba. But you have a choice. You have a choice. Look party. What goes into your mouth is your own choice. Exactly. Not say because you have all this at your reach and all that, let me just eat. But for some people, that party, yeah, I must do. But small chops is very, very important. Do you know that almost every party you get small chops? Yes. Almost at every party, small chops. Even with oil, you will feel it in your hand. Well, and all that. You drink it. I do. So these are sources of extra calories that lead to weight gain. All the small chops you're talking about have been fried. They are sources of trans fat. And these are all the things that are risk factors to you having heart disease. And everything, you don't even exercise, you don't burn it out. And so
how many risk factors does this child have? And the commonest is sedentary lifestyle. In an environment, you will feel that when a child is, big or robust, the child is healthy, the mom feels like, I can present my child anywhere. So I think I don't know, I would want to ask her whether there's also BMI for children, because yeah, we know that kids can also be overweight. So we should also be careful. So it's not just a disease of the elderly. We are all predisposed to risk factors, and you never can tell when it starts. If you see a patient today and you diagnose him of hypertension, I don't think there's any study or data or investigation that can say, okay, it started 5 years ago, it started 10 years ago. You cannot tell when it started. You can only say today this patient has this disease, but how long ago, we cannot tell. And so that brings us to the next myth. Heart disease has warning signs. So, I don't need to be bothered. I know when I have heart disease, it will show. These heart diseases, cardiovascular diseases, are silent killers. Silent being that there is no sign, there is no symptom. And I'm going to relate this personal experience to you. I was consulting a clinic. This man walked in and he came in with his wife. I think she came for a postnatal visit. So along the line, he was like, doctor, he's having headache. And I said, after taking some history, asking him some questions, just little history, I was like, can we just check your blood pressure? And his blood pressure was 220, 120. I was having palpitation as the doctor. I was like, oh my God, this man should not just collapse in my consulting room here. And that day, there and then, we had to admit that patient.
Come and see me and say, oh, doctor, I've seen you. I spent all this money, done all these tests. Aren't you going to give me any drugs? And I said, no, I'm not going to give you anything because I don't know what's wrong with you yet. So if I don't know what I'm treating, what am I giving you drugs for? We do it differently. So again, with your practice, you see people and you know that if they don't come to you with a medical report or list of drugs that they are taking, refuse to treat them. So no, you have to go home and come back with your drugs. We have to, if you don't draw the line, these kinds of drug interactions and iatrogenic things will happen all the time. I refuse to treat people. Go back, get your drugs, come back before we treat you.
So just one last. As regards communication, so some doctors are very funny. And you're like, very explain. I'm like, you don't tell me. Very. Like, you don't tell me how to do my job. And I'm like, for your patient. So if you can't tell me, how do you expect me to take the drug?
Let me help you with that one. As a final thing, I know we're all short of time. So I don't understand that mentality in 2019. When I'm lucky again, in my consulting room, there is a computer. I always turn the computer screen around and show the patients. I go on Google, I tell them this is what I've told you. I'll go to the ESC website or the ACC website and show them and say, this is the condition I think you have. the Europeans said that this is what I should give you. Can you see what I'm giving you? Is it the same? Yes. Okay, we're good. And again, in 2019, when you go and see your doctor, I think, we've all grown up in Nigeria. We all have this culture of respect. You don't want to be rude to older people. Please be rude. It's your life. Be very rude, in fact. But the other point is, you are paying his salary. You are not there for free. You are paying him. So you sit there and you say to the doctor, I'm paying you. Have I paid your consultation fee in full? Yes, very nice. I need you to explain to me verbatim each and everything I've done, because I've paid for your time. So you don't have to ask nicely. You paid for it. When I buy stuff, I don't ask nicely. I've paid.
Any more questions? Kindly write it down and send them. If you're ending this session, because we need to have our promises and close. Thank you.
Okay, yeah, so I'm happy and very glad to be part of this program. Novartis partnering with Heart Dialogue. It's a great opportunity for us to increase awareness about heart diseases, cardiovascular disease, which is actually becoming prevalent in Nigeria. So this partnership is a good opportunity, and I'm hoping that next year we'll have a larger platform to increase more awareness about cardiovascular disease.
So, good afternoon, everybody. I'm just speaking to you from our World Heart Day Dialogue, organized by the cardiac community. This is a very necessary project to spread awareness of the fact that cardiovascular diseases, both the morbidity and mortality, are increasing in Nigeria and other countries like Nigeria. And this kind of intervention is really necessary so people are aware of what the problems are, what to do about them, and where to get their interventions from. So thanks once again for the invitation, and hopefully next year's World Heart Day will be able to do more things to spread more awareness to more people. Thank you.
My name is Folashade Babatunde, and I'm a registered dietitian. This event is a very, very good one. It's creating more awareness about the causes of heart diseases, and not to let everybody know that anybody can be a victim. And it's best we understand what heart diseases are and take precautions in preventing them. And I'm glad I was invited here as a speaker to talk about the nutritional angle of it. What we eat affects our health. The kind of food we eat, the fried foods, the fatty foods, the sugar sweetened foods, and diet plays a great role in what in heart disease, and we need to be very, very careful and know what we're supposed to eat well. And once you know what you eat, you're able to prevent your heart. It's a great investment in your health to invest in your nutrition, eat good food, eat a lot of fruits and vegetables, eat less fat. Aside from the less fat, you're eating more of healthy fats, avocado, nuts, and all that. And you're being active, because activity too is also, physical activity is also very important in achieving a good heart health. So it's also very important you know all this, and once you're able to put it all together, you're able to invest in your heart health and get better, and you are able to protect your heart from every form of side effect that can occur. Thank you.
All right, so I am Augustina Emele, a public health practitioner and also a founder of Chase Initiative. It was an exciting event and educative program. We had so much interactive section with so much experts from across different sectors of healthcare space. I learned a lot. I learned about side effects of drugs and the management and treatment of if the doctor tells you to take healthy diet, exercise more often, take longer walks, please do it. It's better off to do it than to do it when you are forced to do it or when you don't have any other option. At least a little exercise, little physical activity keeps you away from cardiovascular diseases. It was something that I learned so much about, because for me, I already have a predisposing risk factor, in the sense that my family tree, or say family line, I already have high blood pressure. So it just emphasizes on all the things I've already been I'm doing, and give me more knowledge on things I should even do more. I think we should be more careful, because gone are the days when hypertension or any cardiovascular disease was only just for the elderly or the older people. Even the young people are now currently sick of these same diseases. So we should be careful. We should practice all the things that we've learned today and be a champion of good heart, and also be a champion of healthy heart, and also help other people